My research paper was about the ethics of ABA therapy, and I am going to give my key points that I talked about in this essay. So first off, what is ABA? ABA is applied behavior analysis or behavioral therapy. You use ABA to increase behaviors that are helpful and decrease behaviors that are harmful. You can do this in many different ways using FCT, which is functional communication. That is when you communicate your needs and wants. This type of therapy is typically for individuals with autism spectrum disorder, but you can also treat other things. The only downside to that is that insurance will not cover ABA services unless you have an autism diagnosis. Okay, we're going to talk about the history of ABA. So the history of ABA, it used to be called behavior modification. There were a lot of flaws to it. It has similarities to how it is today, but back when it first became a thing, the BACB Code of Ethics was not a thing. So they didn't have guidelines that told them what they needed to do, what was ethical, the ways to treat their clients, and they were able to get away with harming their clients or doing things that they thought were right that were ultimately harmful without repercussions. They didn't have any adequate training. They were just going through like a single day course and then being thrown into the field with clients, and people weren't practicing the same way. They weren't following protocols the same way, and this was causing a lot of harm to patients, again, without repercussion. There were things called radical modifiers. These were ethical behavior therapists who were working to fight to make ABA ethical. They made improvements such as proper training and consistent practices and protocols through each session. They made sure that you had the proper training you needed and everything. ABA now, so we do have the BACB Code of Ethics. This is guidelines for everyone to follow that keep us in check and make sure that we're following what we need to do in order to assure that we're treating our clients ethically and that we're not letting things slip through the cracks. We have proper training and supervision is required. So an RBT, which is a registered behavior technician, that is what the therapist is, the one that practices, has a BACB above them and a BCBA above them that helps them and supervises them and helps them learn. Another thing that ABA now is doing is compassionate therapy. We're working on honoring FCT, and we're working on making sure that we're meeting the client's needs and what they want. People who are anti-ABA think it's unethical and abusive. It causes prompt dependency, which means they wait to be prompted before they do something independent, which takes away independence. They say that ABA focuses on compliance over FCT, compliance to do a task rather than honoring that the client doesn't want to do that. They say that it causes PTSD, that it's out of date and ineffective, and that we stop stemming behaviors with no reason. It also says that it's anti-autism because they claim that you are changing who they are as a person to try to fit into neurotypical world. Pro-ABA. So for people who are pro-ABA, they say that ABA adds tools to the individual's repertoire. This gives them skills in real life so that they can gain independence and life skills that they can use to use in their everyday life. We work on honoring FCT. Stimming is only stopped periodically to complete a task, such as a worksheet in a classroom or folding a shirt, things like that. My stance is that ABA therapy is ethical when practiced correctly. you have to follow the BACB Code of Ethics. There is no way around it. If you don't follow that, you will not be practicing ethically, even if you feel like you're following your heart. When you work hard to always put the client first, put their needs first and make sure that their needs are met. When you're honoring communication, when you don't block stimming unless necessary, don't just stop it just when they're walking around because it is calming for them. Make sure you are meeting your required observations and that you're making thorough reports. Those are very important because it helps to keep you in check and make sure you're doing what you need to do. Consequentialism looks at the outcome. So if you're looking at the outcome of ABA, it's a bit complicated because it's a very individualized program. Some see success and some don't see success because every individual is different and every outcome might be different even though you're using the same action. And there's never one outcome for a student or a client. Deontology is focusing on the intention of the act. This means they're focusing on the act rather than the outcome. So this is the opposite, where it's, again, more complicated because each program has different protocols. They need to follow the protocols for that specific client. Clients have different needs, and not all protocols work for every individual. You might try one thing with someone that's successful and another that's not, which is a big reason why it's so controversial. ABA has set rules and does not make decisions based on just your personal morals, which has a little bit to do with the deontology aspect of how they think that that it should come from the rules set in your heart and things like that, but we need to follow our set guidelines. Ethics of care. So there's harm versus care. You want to do no harm to your clients. You want to make sure that you are caring for them. Fairness and reciprocity. This one's a little more complicated because it's hard to know if it's fair or anything because the reciprocity is financial. So you are paying for these services, and so it's more complicated to know if it's fair. Authority versus respect is another complicated one because you have to work on, so the therapist has authority over the client, but the client has authority over their services. So their program, whenever they're old enough or their parents or guardians have say over what protocols and what goals you want to work on. If they say no to a goal, you do not do that goal. And so you do not have authority over their program as much as they do. So it kind of balances out there. Compassionate therapy is something that ABA is working on, and that has to do with ethics of care. And it does fall into the ethics of care long-term dependence because a lot of our clients grow up and they don't have full independence. They will be dependent for their whole life. So that is another hard thing about ethics of care. It helps us to learn that. What I learned, so ethics has many different elements to it. You have to look at ABA from every angle. It's helpful to look at all three: deontology, consequentialism, and ethics of care in order to properly do your work. Following protocols rather than what you believe, that's a big one that I learned. Do no harm. And understand the concern, and I understand the concerns of those against ABA because you do need to make sure that the clinic that you are going to is providing ethical services. There are some that do not because they slip through the cracks, but you can look into it and research and get opinions and do what's right for you or your individual needing these services.